All right, Rochelle, let me know when the recording gets started and then we'll get rolling.
Good to go, Lisa.
Hi, everyone. Welcome to Pathways to Health and Homes Learning Community webinar. Really excited to have you here with us today. Thank you for joining. We'll be starting the presentation in a few minutes. You should be able to see the title slide on your screen for the presentation. All participants will be muted, but we love comments and questions, so please feel free to send us a message in the chat box. If you need any technical support at all, please also reach out. We are monitoring the chat box, and we want to make sure that you have your questions answered by either our speaker or our staff. All right, and so we'll go ahead and start now. Welcome to today's Pathways to Health and Home Learning Community webinar. Thank you for joining us today. Today's presentation is being recorded, and the recording and the slides will be available shortly after we finish in the next day or so. I will be introducing today's topic, briefly reviewing our meeting agenda and a few ground rules, and then introducing our speaker. If you have any technical problems, please feel free to send us a message in the chat box. We are here to help. All right, so let's go ahead and get started. So today we are going to be doing a training on Plan, Do, Study, Act, PDSAs. And PDSAs are an important part of the Pathways program. The PDSAs are a tool for us to continue to test and implement and improve processes over time. Pathways is a pilot program, and so we've had the luxury of being able to test how things work and augment how we do things. And the PDSA is an important tool to support that activity, both within your organization for Pathways, and it can also be leveraged for other programs as well. I also wanted to mention that PDSA is an important part of whole person care because it's also part of our reporting requirements to the state. The state requires all pilots to submit PDSAs twice a year in our mid-year and annual reports. The PDSAs really tell a story about our pilots, how our pilot is doing, and what were the challenges on the ground, what were the lessons learned, and really provides a view of how the pilots are augmenting and improving processes. And that is really a reflection of all the hard work that our service providers and frontline staff do day in and day out. So PDSAs must correspond with our pilots' universal and variant metrics. And we work with partners to submit PDSAs every quarter to inform these programmatic PDSAs that we submit to the state. So this is an important function, but it's also a great tool for everyone to have when they're looking at standing up programs or improving processes or trying to improve outcomes. So today we're gonna talk through the training. We'll do a little bit of an icebreaker and really, as part of the training, answer some of the key questions about why PDSAs matter, how can you operationalize and utilize PDSAs within your organization, and particularly for frontline staff, what is your role in the PDSA process? So we'll go through that. We'll also do a little bit of a group practice on PDSAs, and we are very excited for everybody to participate in that. So I'm gonna pause briefly if there are any questions around the agenda. All right, seeing none, I'm gonna move us along. So, you know, our goals for today is really to support and reorient partner organizations around quality improvement planning efforts using this PDSA method. You know, we also wanted to provide this training and this recording because we also know that there are also new staff coming on board, and we hope that this will be a useful training tool for your team. Providing Pathways related examples is another goal that we have. We want to talk through how this tool can be leveraged for the work that we're doing collectively. And we also want to talk about some of the challenges and successes within the Pathways PDSA process. we really hope to support building organizational capacity for your organization and for your frontline staff, and to support communications between and within partner organizations. So, I think it will be a really useful tool for everyone. I also wanted to mention that at the end of this training, we will also be providing a short, quick update on the California 1115 waiver, the latest news on it. So please stay tuned. All right. So just to go over a couple of ground rules for today, today's session, there are no bad questions. We really want all questions. Chances are, if you're thinking about that question, somebody else is. So please feel free to ask any questions. There are no stupid questions. There are no bad questions. We encourage everybody to use their own computer because they're going to do some polls and a couple of chats. The chat box is also a good way to ask questions throughout the webinar. And if we do not get to answering your question during the webinar, we will definitely follow up with each of you to make sure that that question is answered. We also ask that you do not share any personal identifiable information about yourself or Pathways clients in the chat box, as this is being recorded. This recording will be made available shortly after today's webinar, and we will be also sending out the link. Okay. So with that, I am going to move us into an icebreaker. Please share your thoughts with us. This is sort of a fun question. If you got $1 million today, I'm going to hand you a suitcase full of money and you have to spend it in 24 hours. How would you spend it? And please feel free to either unmute yourself at this point and share some answers, or feel free to also pop it in the chat.
I think I would first pay off some major bills in my house. I would probably end up helping my sister-in-law pay off her house. And then if I had anything left over, I'd probably donate it back to my company. Honestly.
That is a great answer. I'm looking at the chat box too. We got some responses from others. We've got buy a big house, pay off student loans, pay off all debts of all that I care about. Oh, that's a really great one.
Think it all in real estate.
Yeah. Oh, create a foundation and donate. These are wonderful answers. And, resources are just so important. And, nobody knows better than you guys how important it is to resource and meet the needs of the clients that we're all just collectively trying to serve. And, the luxury of having $1 million, how would I spend it? I think I would actually just pick a street randomly, walk down that street. And I think it would be actually really interesting to just hand out like, I don't know, $10,000 at a time randomly, and to people that you see and see how they react and how they would use it. I mean, I think it would be a very interesting thought experiment. And I bet we would have quite a wide range of folks that we would see in need, and quite a wide range of responses. All right. Any other? Oh, let's see. We have some really fun responses too. Dominique, thank you for your comment about paying off student loans, and with the remaining $7, get chicken nuggets. I would probably do the same. All right. Well, thank you all for participating in this icebreaker. I think these are really wonderful and great ideas. Okay, so with that, I am going to move us along and wanted to introduce our speaker, Dawn Johnson, who is with us today. Dawn and I have known each other a very long time, and I'm really excited to be able to bring her on board and have her provide this training. She is RN with over 20 years of experience in healthcare. And she's worked for many, many years on vulnerable populations, health policy, and public-private partnerships. I would be very remiss if I didn't mention that she spent almost 15 years working for CMS and the VA in DC, and has a very deep bench of experience working with health plans, hospital systems to manage systems change projects. One of the reasons why I'm really excited to have Dawn too is she's also a guest lecturer for Johns Hopkins, a fantastic trainer. She's actually trained CHWs on these topics as well. And so, with her experience with health equity and a deep understanding of this work, she has a wealth of knowledge to bring to the table. So we hope that you all take advantage of this opportunity. As I mentioned before, there will be opportunities to talk to Dawn afterwards with one-on-one consultations. So we're really looking forward to engaging with each and every one of you as we dive deeper into PDSAs. Okay. So with that, I'm gonna turn it over to Dawn.
Thank you, Lisa. Can everyone hear me okay? I'm going to look for shaking heads. Great.
Yes.
Well, I'm really excited to have the opportunity to have a conversation with you all this afternoon. So this is training, but this is us engaging in a conversation to make sure that we're all invested in doing this PDSA process correctly. Because at the end of the day, we want to make sure that our vulnerable populations get the services that they need. And so that's, Lisa said a lot of wonderful things about me. What matters to me most is, and what has always mattered to me most, is the person at the end of the policy, the person in the bed, who's really going to benefit from the care and services. So with that, I wanted to start and talk about what I think everyone loves so much is PDSAs. And the first slide that we have is really, why do they matter? And I think Lisa went over, Pathways being this project that, is really about making sure that connections are there for social determinants, housing and social services, and all of the things that the vulnerable population needs in order to reach quality outcomes. And the project is really about testing how you break down the silos between clinical organizations, between social organizations, between housing organizations, and outreach and engage populations to connect the dots for them. PDSAs are also available to help us figure out what changes worked, what we had to tinker with, and what we just needed to let go of. And learn from. So I think what I want to make sure we hear today very clearly is that every program and every test that you don't see the results that you're anticipating is a program or a test that you're learning from. So don't trash those results. It's lessons learned. And then I want you all to also think about what you would not have learned if you did not intentionally have a PDSA in place. So let's go to the next slide. So I'm going to pause because what I want you all to feel very comfortable doing is writing in the chat if you want me to stop, if you want me to go back and talk a little bit more about something, if you need me to expand with an example. If you have an example and you want to see if it fits into the framework of what we're talking about, I've got a lot of time this afternoon, and there are not a lot of us, there are enough of us to really engage in a conversation. So how can your organization use PDSAs? And so it's really to think about whether the change will work in a real world environment. I think, coming from a health policy background, sometimes you create policy that could never be implemented, or you create regulations and payment methodologies that in the real world actually don't work. And so PDSAs give you an opportunity in real world environment to test things, to see if those outcomes are achievable and what systematic changes or functional changes or policy changes need to be put in place to reach the outcomes you're striving for. So it's also an opportunity for you to figure out what the return is. Is the return a financial return? Is it better satisfaction for your population or your clients? And when I say clients, I mean the organizations that you work with. Are they able to connect with you easier? Is coordination easier? Have you invested more time or less time because you've done something more efficiently? PDSAs help you figure out what combinations of changes are needed. So when you think about community integration, it's not a one way. It's, how many directions does this need to go in, and how many people need to be integrated into the process to help with transitioning our population. I think if everything was simple in healthcare, we wouldn't be having conversations that I started more than 20 years ago, and we're still having those conversations today. So I think those are ways that you can use PDSAs. When you use a PDSA, you can also confirm what you already believe. You have a good idea, you have an assumption, but you want to test that assumption and figure out what variables you may or may not have already considered. And then they always allow us to look at things with the lens of equity. So have I been inclusive in the design? Have I thought about all the people that this is going to positively impact? What are my unintended consequences of doing it this way? And then you also want to look at using PDSAs to lower resistance. So sometimes you will be challenged on the way you're doing something, and a PDSA allows you to systematically, methodologically walk through a process and say, here's the information I gathered, here's what I've learned, and this is why we're doing it this way. And it helps with internal stakeholders and it helps with external stakeholders. So does anybody else have any thoughts on how your organization has used PDSAs and what you've learned just this far in using PDSAs?
That's such a great question. And if folks would like to speak, feel free to unmute yourself at this time or post in the chat. I'm also thinking, we talk about PDSAs in healthcare, evolving and use of PDSAs on housing, I think would be incredible, especially since the housing processes are quite complex themselves.
Okay, seeing no chatter, I'm going to move on, but I want you to think about it. We're going to come back to that. Next slide, please. So when we think about the roles of the stakeholders involved in PDSAs, we want to make sure that, when you consider that lofty goal, that aim, what are you really striving for before you develop your test? Who's the champion? Who's the executive sponsor? Who do you need on your team to figure out how to affect change in the system? Who do you need on your team to make sure that functionally things work the way they're supposed to work? What experts or technical expertise do you need to make sure that the design is correct, the data collection is correct, the analysis is appropriate? So I don't want to make this more complicated, but I want you to think about not being a team of one and making sure that you incorporate others into your processes, because a diverse group produces a much more comprehensive solution. And it's that diversity of thought that will also challenge some of your assumptions. So what I want to do at this point is to allow us to take a poll. And the next slide, there is a poll, because I want to know who I'm talking to, and I want to make sure I'm engaging you correctly. So there is a poll, and I think Rochelle is going to walk you through some of the questions in this poll. And I think the only question in this poll really is, what is your role in the PDSA process?
Hey, Rochelle, you're cutting out. Can you repeat yourself?
Yes, so we are going to be doing a poll that is in progress right now. And as Dawn said, the question is, what is your role in the PDSA process? There are multiple different choices for you to go through. So I will let that go for a couple of seconds. Everybody can answer.
Great. And as you're answering, I want you to think, you know, are you that executive sponsor, the frontline team leader, the functional leader, clinical support? I mean, you could, we only gave you a couple of options here, and maybe you don't fit cleanly in one of these options. And I'd love to talk about it once we see how this lands, once you all have answered the question. You know, when you think about PDSA, are you helping identify the mechanisms that need adjustment? Are you part of the process that's carrying out the change that do? You know, are you part of the study? You know, you're learning and observing from what was implemented and understanding the implications. And then are you part of that team that is determining the modifications that need to be made in order to implement? I'm not sure where we are. It looks like there's still activity going.
So folks, if you have technical challenges, please let us know through the chat. Or we have folks on standby that can be of support and provide additional TA to help troubleshoot any challenges you're experiencing. Welcome everybody to participate in the poll, and it's fascinating. So we've got 3 answers around day-to-day leadership and 5 other. I'm curious, for those who chose other, what has been your role? And feel free to either say it out loud, go ahead and unmute yourself, or put it in the chat.
So I'm wondering if the other is I'm IT, or I collect data and I don't fit into any of these. You know, it looks like Richard is a case manager and he manages a caseload. So I'd say, Richard, as you think about the PDSAs that your organization is working on, what roles have you played? You know, are you collecting data? Are you documenting? Are you actually part of the test? So are you communicating certain things to see if there's a change and improvement in the process? So maybe you might not recognize your slot from the way that we've categorized it, but you may be day-to-day leadership, or you may be a technical expert because of what you're doing relative to the PDSA.
I think in Pathways, I've been in Pathways for 16 months now, so I'd say I'm in a leadership role as a lead case manager, as new case managers are coming in and seeing the process and what has worked for me, not just what's been implemented, also what works for you, and sharing that with your other case managers and your colleagues. Because just because something's implemented don't mean it's working.
That's right.
So I found the way that it works, and I think in 16 months, I've housed 23 people. So I think the program that I got trained by my program coordinator, she moved on to another role. Another one of my colleagues moved on to another role, and then 2 more case managers came on board. And I think I'm a team leader also.
That's fantastic. Yeah, these are all important roles, and we can't forget that, you know, as part of the PDSA is to define this process and this task, collect the data, and then look at the results together and then tweak how you do things. And so it's really great because the role of the people actually doing the work on the ground is so core and critical to the success of the PDSA.
Absolutely.
Most definitely. And it sounds like you're wearing a number of hats. So you've got a hat on for this, and depending on what test is in motion, you've got a different hat on. So I think the ability to be flexible and understand
Absolutely.
just how to fit into the process is key to successful PDSAs.
We did have
So
a couple
it
of
looks-
other comments in the chat box. Chris, thank you. Chris is a grants and contract manager playing a role in the documentation process. Joyle mentioned she has data management, reviewing, analyzing data, and leading and being involved in the PDSA from the data lens. And Jasmine, managing, analyzing, and reporting out on the data. I think many of us recognize that you guys are sometimes wearing multiple hats at the same time. I mean, Tahiri, I'm looking at your comment and thinking, geez, like if you had hats, it'd almost reach the ceiling for each role that you play. So you're absolutely right. You know, it's critical for folks who are assessing the situation, thinking about how to change process and study results and think about next steps. You know, folks like you are also critical to the PDSA process.
Great. Okay, so are we ready to move to the next slide? Great. So this is our grounding slide. And I say that because this is the slide that, you know, summarizes the process at a very high level. And so what we're going to do in the next couple of minutes is walk through each of these components. So let's move to the next slide and let's talk about planning. And so when you think about planning and the plan, there are a couple of questions that I feel like you should consider. And what you should do in the plan is really describe your test pretty briefly, straightforward, and then determine how you know that that change is an improvement. So as I think about these questions, it also makes me think about, okay, what do I need to collect in order to determine that? Think about what driver the change impacts. So what are you trying to move, and what impacts that movement? And then what do you predict will happen? Again, a lot of times you're conducting a test because you know or you believe you understand why something's happening, and you're going to conduct the test to confirm this is why something may be happening. Are there other questions that run through your mind when you begin to plan? And if there are, I'd love to hear them. And you could just put them in the chat as I go through, and Lisa will pick them up and we can talk about them. But in planning, go ahead. Yes.
Go ahead, Terry.
I was I'm actually pulled up my last PSA tracker worksheet I did. So I'm actually looking at it as we're talking. And one of the things on the plan that wasn't mentioned is ours say, how will you measure if your test made an improvement? That is asked of us on our plan.
Mm-hmm.
So when we get to it, that I'd be curious what you would recommend for that piece.
Mm-hmm.
Right. Yeah, so when I think about figuring out if my test made an improvement, then I need to know where I'm starting from. And so a lot of times we're off to the races and we haven't figured out, okay, what was ground zero? Like what was our baseline so that I could say I made a change? So measurement, you know, it's a process, but there are always these things that need to stay in your head, because as you're designing, you want to make sure that you're collecting the right data to say that I made an improvement. And some things are much easier to say, you know, the percentage increased, but some things are much harder to determine and improvement. So I'd love to, you could take that example and let's pull it back out and talk a little bit more about it.
Yeah, and
Anyone
Dawn, I'm so glad you actually mentioned baseline. I mean, some PDSAs for the first cycle is about actually collecting baseline data so that you don't have to come up with what that is. You can actually use the PDSA cycle to say, okay, we're gonna collect the data first to see just what's happening now for our baseline.
Yeah.
And Dawn, I was curious, like if you use that approach and build that, how common is that? Is that something that we should be considering building in as a way to really think about metrics?
I think it's critically important, especially when you're trying to show the impact of your services or changes in utilization or the number of people you may need to hire because of what your organization is doing. I have scars from programs in the federal government where we were driving and building the car, and then we thought, oh my, like we should have measured how many miles per gallon we were getting, because now I can't say that my car is efficient, and if you're never starting at zero and saying, okay, I've used this much or I've improved this much, then when it comes time to substantiate what you're doing and ask for something, it's really hard to go back and figure out, because some information, it gets replaced. Depending on the data system, that field or that data has been replaced with something else, a new value. So it's really important just to be mindful. And it depends on what you're measuring, but it's barely, I haven't found a time when I didn't need a baseline. You've lost 3 pounds, but where'd you start? I don't know.
It's different when you're starting from 90 versus 150 or 200, right?
Yes. Or we need 10 more caseworkers or CHWs. And why? Has your population increased? How are you measuring that increase? Where'd you start? Okay. Next slide. So this slide is really me pulling planning apart a little bit and thinking about the steps that are necessary to complete the task. Who's going to be responsible for those steps? When do those steps occur and where do they occur? So I think what's really important in the planning process is to make sure you have the right people involved in the conversation. So it may be a clinical function, but you may need the data team. You may need your ops team. You may need someone from administration, because depending on what you're trying to figure out, there may need to be a procedural change, or you may need to change something that relates to the system, not just the department. So if you start with a broad group of stakeholders, then you don't have to go back and say, oh, I need to bring you into this to help you understand what I'm doing. It also helps because it will shorten the time for communication. So everyone's there, everyone hears the message, everyone can then distribute the message. I don't have to do this 4 times because my team, who covers multiple departments or multiple areas of functionality, can go and communicate to their team. So think about planning and communication. Think about developing forms and who's going to collect the data and how often you're going to collect the data and where it's going to come from. So I think, I've had teams that have built PDSAs and then you find out, oh, we don't carry that data element in our system, or that's not something we usually collect, or we need to program for that. So we need a makeshift data collection tool. So it also spreads the work out. So I'm always for utilizing all the skills that are in the organization and making sure that their lens is also included in the process. Any thoughts on this planning slide? Any good experiences or bad experiences, or anyone that was a team of one that realizes they needed a team of 5 once they got into the PDSA? Okay, I'm going to move on. Next slide, please, Lisa. So what I wanted to do was to just show you that there are team members that are internal to what you're trying to do. And sometimes you might think, okay, it's a adverse drug reaction, and I want to make sure that all my clinics, my integrated clinics, are able to reduce these adverse drug events by 75% within 11 months. So, you know, maybe I think I only need the clinical manager and the pharmacist. But as you pull it apart, you think about what's the impact of a adverse drug event. So maybe I need to involve my risk manager, because that's who also needs to be in the communication loop. And if I'm trying to reduce something, then maybe that person already has the data that I need that's baseline, because they've been collecting it, because that's part of their role. So it helps you as well to bring them in to the process. I also then need staff education. You know, who's going to then help me train the team on the change process and whatever results at the end of this. And sometimes your organizations aren't that big and complex. And that one person that's on the screen today is all 5 of these hats, and that's you. And that's very real. And so I think if you're wearing multiple hats, then sometimes you have to take that hat off and say, now let me think like the risk manager. And let me take off my nurse manager cap and think like risk manager. And let me think like operations. Now, what do I need to train my team on? So it may just be you, and that's the reality of healthcare. Everyone is wearing multiple hats. But if you are, then you have to make sure you're taking off those hats and putting yourself into different roles. Does that make sense? Any thoughts or concerns about that?
Thinking about applicability too on the housing side, I mean, I'm going to pick on Tahiri again, but I'm wondering if this also lends itself to that sometimes you're wearing multiple hats, trying to think through all of these different lenses and have some similar experience as well. I'm curious, like folks like Bakhtash, Sam, you know, has it been a challenge pulling together other staff and teams or to help with the PDSAs?
Yay, yes and no. I think when, like I said, I inherited this PSA, I had the advantage of actually being able to come up with plans because I was a new person coming into this program, and I immediately saw this system looks broken. This process definitely doesn't look like it's working. So my actually coming up with tests have been easy for me because I did so much changes in the last 6 months, because I could just see with being that stranger walking in of wow. And so that to me, I think was an advantage. And I think I had a team of people that were screaming for help, that they knew it wasn't working as well as it should, were really willing to try something new and different. And I think so my situation, I think, is different because they want to have better streamline or a way to do things that make their life easier. And we've gotten, I think, in the last 6 months at such a different level of service that they're actually thrilled that this has worked and that we took those chances and tried different things. And it really has made an impact. I mean, before I made some major changes on job duties, you know, we were just turning in like 25 RIFTAs. And once I made the changes, we did over 50. So wow. it really can have statistical impact. and see those numbers. So
That's really great.
I've been fortunate on that.
Thank you. Thank you for sharing.
It sounds like there was a lot of opportunity, and you walked into a lot of room for improvement. And then what you also had was a lot of team members that had experience and knowledge about what wasn't working.
Yeah.
So that also helped you say, don't go down that path. We used to do it this way. We need to design something and test something different. So I think that that benefits you, and it's fresh eyes are always wonderful eyes. So as you think about your teams, bring in the fresh eyes. So sometimes when we're doing a process, we don't even recognize that there's an opportunity for better efficiency in our process until someone else comes in and say, why are you doing it this way? So I'm glad to hear. Okay, I'm going to keep moving. Next slide. And I think we can keep going. I think we just had a real world experience, so I don't think we need to have one. And so when I think about PDSAs and the doing, this is when you're actually going to test the changes, and complete the cycle as planned, if possible. And sometimes you may not be able to complete those cycles because they're either not producing the results, there's an untoward effect, or there's just not room to continue that operation. What is also important as you're doing is the documentation. So you want to collect the positives, the observations you're expecting, and the observations you weren't expecting. Remember, I said there's learning in all of this. So if you thought that housing provider offered all these services and you made that connection and then you found out something different, that's great data to have, because now you understand what they do and don't do better. And so I want to make sure that the data or the information that you collect helps you either adopt that process, or abandon that process. And making sure your observations include those things that were not part of the plan, because then you could say, oh, I had no idea those services were available, or that connection also required these 4 things as part of the process as well. Next slide. What's important about doing is telling, and your process will have a much higher rate of success if you're communicating with your team that actually needs to put it in place. And so sometimes it sounds like, this is basic and this is what I already know, but sometimes when you're deep into your plan, someone comes back and says, I had no idea we changed our process. I've been doing this the same way. I've been on vacation, or I've been out, or this is the way I do it. No one told me. And so you're in the midst of conducting a PDSA with a shift in the process, but not everyone's been communicated. And that's why it's really important to make sure that that team covers all the bases, or those hats that you wear, you make sure that all the people that are part of the process also know what's happening and what's changing and for how long, and what tools you're using. So there's all the work that you did in planning should be communicated and should be distributed to everyone so that your test can go according to plan as much as possible, and you get a robust set of information in order to measure the impact. Next slide. So then I think this will resonate for a couple of folks that collect data. And I think, as I mentioned before, a lot of times we build things and put things in place, and we don't build the data collection tools that we need at the same time. And so making sure that those collection tools are also providing us information about the metrics that we want relative to our PDSA. So are we measuring an improvement in something? Are we measuring access? So the number of days to before you can get an appointment, the number of days before you get access to something. How are you measuring those things? Some of those measures are process. Some of those measures are outcomes. And so think about how you're collecting and documenting your data and what measures balance from a system perspective. So when I say a balancing measure, you can want to reduce the length of stay, and maybe you're getting your people shifted much quicker, but then are they going to the ED as a result of it? So you decreasing one thing and increasing something else. So you want to make sure that you also have a holistic view of what's happening to your population as a result of your intervention. So if your housing provider gets more referrals, does that now mean that the time frame for access has also increased? So then what happens as a result of that? So think about that. That's also when you need to think about what other resources do we need to put in place to make sure that this is moving. Any thoughts on data collection? Anyone have experience with data collection?
And Dawn, we have a question from Tahiri on the PDSAs. They have two types of plans, one that has been complete and new test plan with dates, but no results yet. Tahiri?
Let me explain it. When I inherited this, I had a PSA, and I was reading this and there were dates that were like, and I wasn't sure because it's like, okay, when we submit these, are they supposed to be on tests that we've already planned and is fully completed? And then I'm thinking, well, shouldn't we also be listing our new ones? So it's a ongoing doc that these are the old ones, these are the ones that I plan on doing, and then that should have results in it when I turn this in again, and then some new ones. But I never got clarification of how these are supposed to be submitted or done, and that's what I'm asking.
Got it. And Dawn, I can go ahead and answer from a date perspective, and feel free to add to my response. Tahiri, we do PDSA cycles on a quarterly basis, and we ask partners to, you guys get to choose what PDSA tailored to what's local within your organization. And the submission really is about that cycle in that quarter. And we also, it's totally okay to use the same PDSA, say like you're in the first cycle and the first quarter, you're just collecting baseline. And you want to use the same PDSA in the next quarter and run the cycle again after you've implemented the process to see what changed from baseline. And that is okay too. So it all depends on what is the local need and did you get the process or the flow or the outcome that you wanted before moving on to a different PDSA.
Thank you. That helps me a lot.
No problem.
Great. Let's go to the next slide, Lisa, unless there's more in the chat. Great. So this is where I want to get some feedback from you, because as you are studying what you've put in place, I want to know, how are you doing? And are your results matching up with your predictions and your assumptions? And have you been able to make those comparisons about baseline to this period of testing? And what have you learned so far? So the next slide is really a poll, and I want to make sure that I want to talk about this one. So prepare yourself to participate. And first, you've got to answer these two questions. Rochelle?
Yes, thank you, Dawn. We are going to have another poll for us all to partake in. And so there's 2 questions, so go ahead and answer both. The first question is, what % of the results match your predictions? So after you've done the plan, the do, now you're studying your results. When you are studying them, what percentage of your results actually match your predictions you made in the plan section? And then the second question is, what % of your plans required changes to policies or procedures?
Before answering this, I have a quick question. So are we answering in regards of the last quarter or generally speaking?
Let's make it
generally speaking. Yeah, unless someone wants a specific quarter.
Thank you.
You're welcome.
good clarification.
No, I
Good
think,
Josh.
Go.
And we have
Okay.
3 responses so far, so I'm going to give everybody a chance, if you haven't answered yet, to get to the poll.
And remember, nobody's going to be graded on this. Totally anonymous. But please feel free to pick what you think the answer is too.
And we didn't leave an option for I have no idea. So if that's you, you could do less than 25% and we could talk about it. But hopefully that's not too many people. Okay.
And we have reached critical mass, so I will end the poll and share the results now.
Ah, great.
Great. This is great. So does anybody want to talk about like someone from, and I'll try to pick those that have wider, a couple of folks in there, so it's harder to identify. Someone from the group of 50% want to talk about what you learned from that other 50%, or what you learned in that testing.
All right, I would step in if you don't mind. So I said 50%, so it's usually, we discussed this before, the main problem was in the past, especially for us, like was transportation, right? And throughout the times I was trying to find a solution for it. And for example, I had this thought maybe we could offer like bus passes to patients to their appointments. And at some point we thought maybe, okay, some of them may be open, some of them won't, but the recent quarter, the last one that I submitted, it just didn't work out at all. So I thought maybe some of them will be open, but it just, at some point I just had to stop and discontinue. It was just waste of time. So throughout the time, so that was the time it just didn't match at all. But there are some times that, you expect something and it's just exact as you expected. So, for example, but ultimately we found a solution to it, to transportation, and I requested a budget from the company, from the upper management, and they were kind enough to give me like 10% budget, and we ultimately solved the problem. But throughout that process, I was trying to look for a solution other than a ride-sharing applications and spending our own money. And bus pass is one of the solutions that was absolutely failed and below all the expectations.
Yeah, periodically, sometimes what you're testing just doesn't work. And that's actually okay too. Knowing that that doesn't work in your situation is good information.
It was a good thing to us specifically. I could showcase this to the upper management that, hey, there's no other solution other than giving me budget, because my patients, they're just simply missing their appointments because they don't have transportation. And thanks to other partners, we've been like collaborating, and people would give me, like a right or two a month, but it's an ongoing process, and we need a solid solution. And this fail actually was a curse. At the same time, it became a blessing, because that showcased to them, okay, we need a change, and we need a change as soon as possible. And they approved the budget, and now I don't have a problem. So whenever my patients, they need a transportation to their appointments, and if it's same day appointment or a following day appointment, insurance will never accept that. So I have a tool, I have means to provide, basically.
That's fantastic. And this is exactly one of the reasons why to do PDSAs, because it gives you the information and the knowledge and the ammunition to make your case with your funders, with management, and also with policymakers. I mean, we also, from a program lens, one of the reasons why we gather all of your PDSAs and do a program-wide PDSA is to be able to share what the challenges are, in the hopes that the state will also be able to take these lessons learned and these best practices and be able to inform future policy and new programming. And we are seeing that with what is coming out in the next waiver extension, which I'll talk more about at the end of this training. Back to
Definitely. You, Don. And I think it was wonderful that you said you abandoned, you studied the results and you made a decision to abandon, and then you used your evidence to go back to make your case. And so without that evidence, it would have just been your assumption that you were, saying, I need more money, without real evidence. So that's wonderful. I'll take one more, and I just wanted to be aware of time. So someone that was highly successful, want to talk about that. Someone from the more than 75%. Okay, then I'm going to ask someone from the more than 50% that made changes to policies and procedures. Does anybody want to share what changes they made?
I can share at a program level. Many of you are aware that we track program progress, and we're also constantly looking at process improvement from a programmatic lens. And one of the things we were able to do in looking at how we use the $3,000 set aside for housing expenses is digging deeper and looking at that data, understanding how that those dollars are being spent, and really tracking it. Is our approach, is our cap at 3,000 still enough to support the needs on the ground of patients? And in our data analysis, really started looking and testing at that assumption. Thank you all of you for, you guys have been sharing data through the invoicing process with us, and we were able to demonstrate there's a higher level of need, presented the data, and that made that case with the city, and was able to increase our $3,000 set aside per patient for one-time housing expenses to $5,000.
Great. So let's move to the next slide, and I appreciate your participation, and I just want to say again, no wrong answers here. This is a great opportunity to just dialogue about your experience and what you're seeing as you're doing and understanding your PDSAs. So just to talk a little bit about studying, and I'm going to keep moving on, but
actually, Dawn, sorry to interrupt. I missed Serena's comment in the chat. She mentioned we changed reports that were run and the workflows that CHWs had when working with clients to ensure that the clinical red fields tabs were updated on a regular basis. So that's another really great example. The red fields in our shared care plan are what we as a collective and as a collaborative agreed are critical to have answers for every single patient.
That's great. And if I were just to put my hat on to try and figure out, you know, the nuance of that, it probably was really dependent on the time frame of running those reports to make sure that you're able to see all of those red fields, because maybe there's an overlay or those reports change over time. So you have to make sure if you want to get that month's report, you run it in that time frame so that your data collection is appropriate. So I want to talk a little bit about just analysis and study. And I think, you know, we've mentioned a number of times that we learn from both the positives and the opportunities. And I don't want to call them negatives because they're actually opportunities. And so there are things that we could do differently or experiences that our patients can have that are different. And so collecting all that data helps you refine your process. And that's what was mentioned earlier. We knew that things were not changing and it was time to abandon, but we learned from that information. And so I want you to think about a couple of things when you're studying the information. Think about, you know, the size of your test. Was it too small? Did we use the right kind of data, or did we collect the right kind of data? If we're looking for numbers, did we just collect qualitative data and now we don't have quantitative data to see that there's actual measurable improvement? Was the time period long enough for us to say, you know, this is a change that happened, or if we had 3 more weeks, then we would have seen a different result? And then I just threw a couple of things out because I know that as I've looked over some of the PDSAs, you know, you want to impact the number of patients agreeing to telehealth. So what time frame are you giving yourself to impact that number? You know, and how are you measuring the impact? You want to make sure that you're finding organizations whose services match the needs of your eligible population when you're doing transitions. How are you going to test that? What information will you need in your tests to figure out those things? So you want to make sure that you're reviewing the effectiveness of your policies and your forms in the data collection so that when it's time to study, you're actually able to study. Next slide. Act. And we've talked a little bit about acting, and acting is either I'm adopting this because it's worked well and we need to put it in place and move forward. We're adapting this. You know, I need to tweak this a little bit and then continue to test to see if my results give me the intended impact. Or I'm abandoning this. And we've talked about this as well. Like, this just isn't working for us and we need to change it and plan for something else. And all 3 of these are valid actions. And we need to embrace abandoning things because there's no sense in investing time and resources in something that we see early on is not working. And maybe there's a tweak that needs to happen in the next test, but let's abandon the way that we've set this up. So I want to go to the next slide. How many, you know, and this is general, again, of you have adopted, abandoned, or adapted your changes? And I'm calling on my friend Rochelle again.
Yeah, so I have the poll live. So please choose which strategy that you're employing in your current PDSA cycle. Adopting, abandoning, or adapting. I also put other in case we're anywhere in the middle and want to discuss that. So I'll give everyone a couple of seconds to put their answers in.
And as you're inputting this, I think it's really important to remember to communicate, because you want to make sure that as you abandon a test, the team knows that this test is being abandoned. Let's not continue to work on this process anymore. And we are putting a new process in place, or we're beginning to put that process together. or we're going to change things. So you want to make sure that the team that is putting the process in place and making those changes is aware of all the changes that are being made. And if you're adopting something, then are you creating a new workflow? Are you creating a new way to interact with housing? Are you changing how your patients use telehealth, or what information they get, or what training they get, or what education your team gets? What adopting changes are being made, and how are you communicating those changes? And wow, it looks like there's a lot of learning going on and a lot of adapting. So we're just making some tweaks and continuing to test. And I'm happy to see that there isn't a lot of abandonment. That means that you had pretty sharp assumptions and you set up your tests well to figure out how to get the desired outcome. And maybe there are just some lessons that you're learning as you're going along to make you need to adapt and continue on. So I think the next slide is actually a break, I think. And
Okay.
I think in light of time, I'm going to turn it over to Lisa and she can tell us how we're going to do this.
Awesome. All right. So we want everybody to be able to take a break. We've been doing a lot of talking. So why don't we all stand up, stretch, right? I'll be cheerleader. Give yourself a good break. Walk around. And what we're going to do, thank you for taking that break. You know, these breaks are really important. You know, and many of you participated in our self-care webinar in our last learning session. And so we want to honor the spirit that we brought that webinar and that training to everyone. So now that we're done with this break, everybody got a chance to stretch and stand up. We want to do a PDSA together just so that we get in some practice and conversation. I think what we can do is, I think everybody, this can be an interactive group PDSA that we all collectively put together. So let's dive in. Dawn and Rochelle, let's go to the next slide. Yeah, Dawn.
So what I want us to do collectively is to think about the transition that's coming for the Pathways program, and think about the patients that you have. And so if our big audacious goal was to make sure that we reduce or eliminate the number of eligible patients that are not able to transition. So we want to make sure that we have, you know, greater than 95%, I'm just going to throw it out there, that are able to successfully transition to other programs in Sacramento County. How are we going to do that? What would be one test that we might want to start now to figure out how to make sure those transitions are successful? And you can just throw it in the chat because I want to make sure that Lisa is able to give you an update on what's happening in California. And we can always circle back, as Lisa mentioned, we can always get together and work through some of these things together. But I just want to throw some things out there because maybe the rest of this group is struggling to figure out, what do I do next? And how do I start to frame this? So anyone have any thoughts? Put them in the chat for me.
Great. Yeah, and we thought this could be a fun topic. Oh, that's a great topic to hear, to test. Find out who needs to be referred to PSH, permanent supportive housing. That's going to be particularly challenging given the limitations of the slots, but wasn't it great to hear that the Biden administration is proposing to go to unlimited HCV? So that's an excellent one. And we thought transition could be a good topic for us to collectively brainstorm on, just given as we think about what patients need and how we want to make sure that they have continuity to services that they need both on healthcare and the housing side. a PDSA, we could actually do a collective PDSA on this topic, where as we think and track transition, we get feedback and we're actively tracking, are patients getting information, or are they getting transitioned in a way that they're getting into a program that meets their needs. Richard had a great point. Make sure you set up box.com, SHRA, to upload all the pertinent documents. These are some challenges I'm sure that you guys have had too on the ground, as you know, we have to think through all the things that would need to follow the patient. Serena posted, identify other case management programs and screen clients for eligibility to warm handoff. Ooh, that's a really good one. And that's a process, Dawn. So
that's one to really unpack, because there's an identification piece, and there's a screening piece, and then there's a warm handoff process. So there's a lot there. That's a great one.
Right. Or Tahiri mentioned, set up a termination plan and checklist. Make sure you have all the components in the checklist that you put together works, you know?
So as you're thinking about these, how will you know that the change is an improvement? So think about some of the ones that are written in the chat, and it doesn't have to be yours. Let's just throw out some of the things that we could think about for improvement. I think there's some more in the chat right now.
Yeah, Laura had mentioned providing full support to clients through transition so they don't feel lost. Richard mentioned identifying AOD, substance use disorder needs, for long-term success to housing. Yes, absolutely. And, you know, it's really interesting that you the group raised these. We recently had a conversation with housing partners through the PRK meetings with Sacramento Steps Forward, and issues of trust. How do you build trust with clients so that they hear you when, you know, and understand that maybe their housing is going to end, and we need to support their transition, and that they understand that they have to engage as part of that transition. So how do you ensure that that relationship allows for that level of trust, and you're able to support that individual to move forward? So Tahiri had mentioned for measuring follow-up 1 month after termination to see how they're doing.
And you're reading my mind. I just put in the chat, like, how long? And so this is great. I think those are really, really important. I want us to continue this way of thinking. And I think, you know, this brainstorming for the group is probably giving everyone some ideas on ways to look at transitions. And there's another activity that we wanted to do, and I don't think we're going to have time to do it. And I want to respect everyone's time here. It is Friday. I've been losing track of days since we've been at home. And so I believe it is Friday, and it is 20 past the hour. And so I want to make sure that Lisa has time in the agenda to go over and give you all an update. So Lisa, what are your thoughts on where to go next?
Yeah, I think that's right. So why don't we do this? Let's move on to the updates. What we will do is we'll hold on the group PDSA. We're happy to bring people together to do a group PDSA if there's interest. We also want to make available Dawn in case you want to have a session with her to talk through your PDSA, ask any questions. We're also here to help too. So please feel free to reach out anytime through the Pathways inbox. or anyone on the Pathways team. We really appreciate everybody's participation today. It was a really fantastic conversation, and I hope everybody got a lot out of it. I know I certainly did. So a couple of next steps. We have an evaluation survey. We're going to be emailing that link out shortly after this training. Your feedback is really important because what we do is we take the results of that survey very seriously, and we use it to build in future trainings, future programming, or when we realize maybe we need to go deeper and do a follow-on session. So I encourage everybody to do that. And thank you, Alexis, for sharing the evaluation in the chat as well. And as always, we will make this recording available, and we will be sending out the recording so that you can use this with your team and with other folks who might benefit from watching the recording and from receiving this training. So thank you all. We're going to stop recording at this point, and I will be providing a bit of an update on what's coming up next. All right. So are we paused with the recording, Rochelle?
Yes, you are good to go, Lisa.
Awesome. All right. So thank you, everybody. And as I mentioned before, we want to make sure that you have access to Dawn to ask any questions. We'll be doing some follow-on sessions. And if you want one-on-one sessions on your specific PDSA or to do some additional trainings or conversations, please let us know. So now I'm going to pivot quickly and give an update on what's next in the future of the program. Many of you remember that our program was supposed to end in December, and things were up in the air with the federal government in terms of requesting and getting a one-year extension. At the 11th hour, New Year's Eve, we got wind that CMS was going to approve the state's extension, which is really fantastic. And so the state has doubled up on its efforts. And what we are expecting now is Pathways will go through the end of the year. We'll